Are there any other votes? Announce the results.
Ayes 102, noes 9.
The bill is passed. Mr. Morelli.
Thank you, Mr. Speaker. A very patient Mr. Benedetto would like the members of the Cities Committee to move to the Speaker's Conference Room. Cities Committee in the Speaker's Conference Room.
Cities Committee, Speaker's Conference Room. Mr. Benedetto will be there waiting for you.
Assembly 8228A, Calendar 793, Mr. Simbrowitz. An act to amend the real property tax law.
Read the last section.
This act shall take effect immediately.
Clerk will record the vote. Are there any other votes? Announce the results.
Ayes 106, noes 0.
The bill is passed.
Assembly 8296A, Calendar 794, Mr. Aubrey. An act to amend the criminal procedure law.
Read the last section.
This act shall take effect on the 60th day.
Clerk will record the vote. Are there any other votes? Announce the results.
Ayes 97, noes 2.
The bill is passed.
Assembly 8335A, Calendar 795, Ms. Schimmel, an act to authorize the Flower Hill Hose Company Number 1 to apply for a real property tax exemption.
On a motion by Ms. Simmel, the Senate bill is before the House. The Senate bill is advanced. Read the last section.
This act shall take effect immediately.
Clerk will record the vote. Are there any other votes? Announce the results.
Ayes 103, noes 0.
The bill is passed. Mr. Morelli.
Thank you, Mr. Speaker. I would now like to ask members of the Labor Committee to move to the Speaker's conference room. A very patient Ms. Titus is anxious to begin in the Speaker's conference room. Labor.
Certainly, Labor in the Speaker's conference room. Ms. Titus will meet you there. Please proceed directly.
Mr. Speaker?
Mr. Morelli?
Yes, thank you. If we get a little order in the chamber. I'd like to now go to calendar number 768 on page 65 of the main calendar by Mr. Gottfried.
Clerk will read.
Assembly 5062A, Calendar 768. Mr. Gottfried, an act to amend the public health law and the state finance law.
An explanation is requested, Mr. Godfrey, please. We are on debate. Members, staff, please, so that we may be able to do this. 1 minute, Mr. Godfrey. Still a little rumbling around.
Mr. Speaker?
Yes, sir, Mr. Morelli.
Just before Mr. Gottfried speaks, I just want to alert members during the debate, although it's not my custom, we have a number of other committee meetings that will need to be called, so I may need to interrupt periodically. Just ask members of the committees that have yet to meet to just be prepared.
Certainly. We are reminded. People are still moving around pretty good. Proceed, Mr. Godfrey.
Thank you, Mr. Speaker. About 200 years ago, America figured out that education, while it is certainly a family responsibility, is also a public responsibility. And we came to that conclusion about a lot of things. No one really thought at that time to add health care to the list, because in those days, what was health care? It was leeches and a guy with a rusty hacksaw and somebody who would keep you comfortable while you died. Not very effective, not very expensive. But today, almost every problem we face in health and healthcare is made worse and harder to solve because our method for financing healthcare is almost entirely dependent on health insurance companies. That system keeps us from, as individuals, taking full control of our health care and taking full responsibility for our health care. Now, the Affordable Care Act has made some major improvements in that system, but its major flaw is that it leaves almost all of us in the hands of insurance companies. And that means ever-rising premiums, which we've seen going up much faster than inflation, much faster than people's incomes, and that's continuing to this very day. Out-of-pocket costs, similarly, rising far faster than inflation or incomes. More and more health plans have higher and higher deductibles and copays. More and more health plans have tightly restrictive provider networks, and if you go out of network, you are entirely on your own in more and more cases. All of these provisions are real obstacles to people getting health care and are real obstacles to family financial stability. We see that a third of households who have health insurance report in a given year that one or more family members had to go without health care because of financial reasons, and in about two-thirds of those cases, it was for a serious condition. A third of working-age adults in a given year go without health care for financial reasons. A third of working age adults have had financial difficulty in paying for health care bills. More and more employers finding coverage more and more expensive, and in some ways less and less valuable to their employees because of deductibles and the like. More and more employers still are dropping health coverage, or even if they don't drop it entirely, are shifting more and more of the cost of health coverage to workers, either by having them pay a higher percentage of the premium or by buying policies that have larger and larger deductibles and copays. Insurance company administrative costs and profits, combined with the administrative costs of healthcare providers who have to be aided by small armies of people to fight with insurance company administrative personnel, you add up all of those administrative costs with insurance company profits, and it takes more than 20% of every healthcare dollar. Think of it, of the tens of billions of dollars, hundreds of billions that we spend here in New York State on health care, as 20 to 25% of those dollars are spent on administrative costs and profit that are of no health benefit to anybody. New York can and must do better than that. And that's what this bill is all about. The New York Health Act would create a universal, complete health coverage plan for every New Yorker. Every New Yorker would be guaranteed choice of doctors and hospitals and other healthcare providers. By taking insurance companies out of the picture, we put $45 billion a year, more than $2,000 per capita. We put $45 billion a year back in the pockets of New York consumers and employers and taxpayers. We end the regressive tax that the insurance industry charges us for premiums and deductibles and copays and out-of-network charges. Regressive taxes that are not based at all on ability to pay. The insurance company wants the same premium, they want to levy the same deductible, what have you, whether you are the wealthiest business executive or stockholder or the janitor working in that executive's business. Instead, the plan would be funded fairly through broad-based premiums based on ability to pay that would be levied as a progressively graduated percentage of payroll income and taxable non-payroll income such as capital gains, dividends, investments, and the like. For 98% of New York households, any household earning up to well over $400,000, that financing system would be less expensive than what we now spend on premiums and deductibles and copays and the like. The New York Health Act would dramatically simplify the healthcare process and the healthcare financing process for patients who would no longer have to spend time fighting with insurance companies, figuring out what their benefits are, trying to sort out what a hospital bill says and who pays for what. For doctors and hospitals, likewise, life would be dramatically simpler. They would no longer be spending, as in the case of doctors, 17% of their time fighting with insurance companies. There are hospitals that have more bill fighting personnel than they have beds, dealing with dozens and dozens of different systems. Instead, doctors and hospitals would be able to spend their time providing care, coordinating care, making sure patients are getting the medication they need and the like. Employers would no longer be spending hours of time and $2 billion a year on selecting their company health plan, monitoring the company health plan, dealing with complaints about the company health plan, and all of it for employers as for consumers would be at much lower cost, dramatically lower cost than health coverage is today. The New York Health Act would take a huge chunk out of property taxes, because the New York Health Act premiums would take over the payment for the local share of Medicaid, and local governments as employers would be spending dramatically less on employee health coverage than they are today, because the premiums would be dramatically lower for them as for other employers. Now, any number of people have said to me, well, everyone knows that a single-payer system like the New York Health Act is the only sensible way to organize and finance health care, but, oh, it could never happen. Fortunately, even though that may be true in Washington, fortunately for us, we live in New York. And in response to the Affordable Care Act, which has made it very clear to a lot of people that while it has made improvements, as long as we're in the hands of insurance companies, we will be faced with endless problems. As more and more people come to understand that because of our experience with the Affordable Care Act, there has been a real surge in support for the single-payer concept, particularly in the labor movement, which historically has enormously valued its ability to provide health benefits for its workers, but more and more unions with strong health plans are now supporting the New York Health Act because they see what a burden it is on themselves and their members. The Assembly's support for this bill, we passed it last year, I imagine we're going to pass it again tonight, is helping to advance this issue on the public agenda and change the conversation from universal, publicly funded coverage being something that, well, that could never happen, to being something that really is achievable. New York has led the country from our very founding in doing things that didn't seem doable. We were the first legislature in 1799 to abolish slavery. We were among the first legislatures to enact child labor laws, workplace safety, minimum wage, 40-hour work week, regulation of smoking in public places, gay rights, same-sex marriage, all things that many people thought could never happen. Some of them took a long time to get enacted. Some happened a lot quicker than anybody would have guessed. You know, this country is founded on the proposition that we have an inalienable right to life, liberty, and the pursuit of happiness. And to me, among the things that life, liberty, and the pursuit of happiness mean are health care and the right to control your health care and what doctor and hospital you go to and what care they provide with you. And finally, it means family financial stability. All of those things, I firmly believe, are achievable only with a plan like the New York Health Act, and I hope that our passage of this bill again tonight will help bring that day closer. Thank you.
Thank you, sir. Mr. Rea.
Thank you, Mr. Speaker. Will the chairman yield for some questions?
Will you yield, Mr. Godfrey?
Certainly.
Yes.
Thank
Mr.
you.
Godfrey yields.
Thank you, Richard. What's the percentage, currently, what's the percentage of New Yorkers that don't have any type of health insurance coverage or Medicaid coverage?
It's a little over 5%. There's about 1 million, maybe 1.5 million New Yorkers who have no health coverage. But there are millions of New Yorkers who are severely underinsured, who are paying a lot of money for health coverage that has serious gaps in it, or because of deductibles and the like, coverage that they really can't afford to take advantage of, even though they're paying premiums.
Thank you. Yeah, I had 4.6%, so we're in the same ballpark. Richard, during your explanation, you kind of went in between the term, using the term premiums, when in fact we're actually talking about assessments to finance this proposal, right?
Well, we're calling the payment mechanism a premium largely because that's a premium in connection with health coverage is something people are familiar with. Unlike the premiums that we're familiar with, it's not directly tied to whether you get coverage or not. You get coverage by being a New Yorker, and unlike traditional premiums, it is scaled based on ability to pay.
Well, so in reality, we're talking about taxes. So how is this program funded?
It would be funded through a premium that first would be levied on payroll income, essentially any income that is subject.
So that's a payroll tax.
Any income that is subject to the Medicare tax would be assessed for this premium. Unlike the Medicare tax, it would be progressively graduated, so lower income, moderate income, middle income New Yorkers like you and me would be paying a much lower rate than wealthier New Yorkers.
All right, so in addition to...
Oh, and then the other part of the premium would be similarly progressively graduated, levied on taxable non-payroll income like capital gains, dividends, et cetera.
All right, so we're talking about a new payroll tax as well as a potential personal income tax to finance it. Now, also, it's my understanding that it's heavily reliant on federal funds.
We would continue to draw down federal money for Medicaid, Affordable Care Act subsidies, and Medicare, correct.
But we can only do that if the federal government issues waivers.
Well, it can be done most easily if we get federal waivers, which are provided for in federal law. But even if we don't get those waivers, it is doable to build the New York Health Act essentially as a wraparound of those other programs so that we would continue to draw down the federal money. It's easiest to do that, of course, for Medicaid because we actually run Medicaid ourselves.
Yeah, and we do that so efficiently. But so...
Well, actually, the so-called fee-for-service part
that
of the
wasn't
Medicaid
a question,
program
Richard. That was a comment.
runs a lot more efficiently than any insurance company. The Medicaid managed care system runs as inefficiently as every other managed care plan.